Hi, I'm Dr. Alexis Hazen, and I just opened a private practice in Manhattan. I'm an associate professor at NYU Langone Department of Plastic Surgery, and I'm really interested in anti-aging and wellness, and I'm going to talk to you a little bit about that today. It was a long road, as it is for everybody, but I really think it began when I was a really little kid, and I was burned when I was 2. And my whole face and neck and shoulder were burned. I had to have plastic surgery, which most people don't think of plastic surgeons as being burn surgeons, but that is actually one of the many things that plastic surgeons do. And it was a big deal. I was very sick. I was in the hospital for about 2 months. And then later, it was always something I knew about, meaning I always knew about plastic surgeons and that plastic surgeons helped people. And I think as I got older and wanted to do something that was meaningful and that could make a difference, I always came back to the people who really literally saved my life. And that was where it all began. Absolutely. Much harder. I thought medical school would be really hard, and medical school wasn't that hard. I mean, if you put the work in, you'll do well, and it just was a matter of working. And once I got into the swing of working hard and studying, it wasn't hard. But residency training and plastic surgery training was really hard. And the hours were brutal. There were no work hour restrictions when I learned plastic surgery. And I would literally work sometimes 120 hours a week with almost no sleep. So it was much more challenging than I could have imagined, especially in terms of my personal life. I had a little baby at the time, and it was just, personally, it was brutal. Ironically, it was not about my practice. It was when my father died, and my father died due to medical mistake. And he had surgery that didn't go well. And he basically died a week after surgery, and he shouldn't have. He was healthy. He was 70. It was a total tragedy, but it made me realize, I think I always realized how serious surgery was, but it really made me take note of what I was doing and take all the little details a lot more seriously. And any little error can translate to a huge disaster. And that really changed the way I took care of patients. And I was always serious about it, but it just, the sort of importance of every little tiny aspect of care made me realize, because of that personal experience. I think gotta be at the top of that list is top surgery and helping patients transition from female to male or male to female. It makes such a big difference in their lives and enables patients to do the things that they want to do, wear the clothes they want to wear, and it really helps them with their overall quality of life, not just specific to surgery, but it encompasses all aspects of life. The other procedure is a breast reduction. For women who have really large breasts, it really impairs their ability to exercise and do the things that they want to do. And it again is something that affects their daily life. And I think the other procedure that really makes a difference in people's lives is breast reconstruction. If you have breast cancer and you lose a breast or a part of a breast, it's really debilitating emotionally. And being able to put a person back together makes a huge difference, and it's very gratifying. I think that I am very empathic, and I think I actually listen, and I don't have a preconceived notion of what is right for a person. I actually listen to what they tell me, and then I try to be honest and either deliver that or tell them I can't deliver that. And I think a lot of plastic surgeons become arrogant because of their skill set and because of their training and because we can do a lot. And I think that arrogance really interferes with your ability to listen to people. And I don't pretend that I know best for other people. I don't. They know best. And then it's a matter of communication and are we on the same page? And I think that my skill set is excellent, but I think in terms of technically, but I think the place where I really excel or am different is that I listen and I'll communicate with patients. How would I like to change the medical industry? Oh, this is such a big question. There are so many things I would like to change. I think that administration, and that is broadly all the people that are in between the patient and the doctor, I do not think have helped medicine. And that means insurance companies, it means administrators in hospitals, and obviously there is a necessity to that industry, but it has just blown up. And I think that I would like to get back to the patient and the doctor being the most important relationship and the most valued relationship. And that's not the way it is. In terms of monetary gain, doctors make less than administrators, and insurance companies are privatized and make money. They're money-making organizations, and I have a little bit of a problem with that. I also think that our focus in medicine in general should be on wellness and well-being rather than disaster mode. We only pay for things when they're acute and when there's an emergency. And I think the focus should be on how to maintain health and well-being rather than how to treat disasters. Yeah. It's been really challenging. Statistically, we make less money than men of equal level of education and training. Statistically, we are in fewer positions of power with the same credentials. And in training, it is definitely has its challenges. I was pregnant and then I had a baby. And obviously, my male counterparts might also have had children in their families, but it's very different being a mother and breastfeeding than being a father. So that was challenging. And then it's the one area that I think is not challenging, interestingly enough, is that a lot of patients do prefer female doctors. And there are a lot of reports in the literature these days that actually female patients of a female physician do better. They live longer. There's some shocking statistics out there. So I think that has been the silver lining. How do I deal with people who become plastic surgery addicts and want to have too much done? So plastic surgery can be a slippery slope, and it can be the kind of thing that a little bit is good and too much is not good. And that's something that you have to negotiate with patients, and you want to maintain a natural, normal looking appearance and minimize aging. Then there's something else, which is really a problem, which is body dysmorphism, which basically is when somebody doesn't see what's real. So they see a distortion of themselves. And people who suffer from that disorder sometimes seek plastic surgery to alleviate what they are suffering from. The problem is plastic surgery won't solve it, and they need psychiatric help. And so you need to recognize that, know about it, and then refer them to a psychiatrist or psychologist, and definitely don't operate on them. When people just get addicted to youth, then that can be more of a conversation and more of a process of trying to stave off the aging process, which I very firmly believe in. What do I feel is my mission in life? That's a big question. I guess on the most basic level, to help people, and specifically to help people be their healthiest, most happy, most authentic self, whatever that means.